Disorders of heart walls. 1. Cardiomyopathy. Cardiomyopathy is a group of diseases that affect the heart muscle, myocardium, and can lead to various problems with the heart structure and function. Cardiomyopathy often results in the heart becoming enlarged, thickened, or rigid, which can reduce its ability to pump blood effectively. Here are the main types of cardiomyopathy and some key points about the condition. I. Hypertrophic cardiomyopathy, HCM. HCM is characterized by the abnormal thickening, hypertrophy, of the heart's left ventricle or other parts of the heart muscle. This condition can lead to obstruction of blood flow out of the heart, causing symptoms such as chest pain, shortness of breath, fatigue, and fainting. HCM is often a genetic disorder, but it can also develop due to high blood pressure or aging. 2. Dilated cardiomyopathy, DCM. DCM involves the enlargement and weakening of the heart's left ventricle, which reduces the heart's ability to pump blood effectively. Symptoms can include shortness of breath, fatigue, swelling of the legs and ankles, and an irregular heartbeat. DCM can result from a variety of causes, including viral infections, alcohol abuse, exposure to toxins, and certain medications. 3. Restrictive cardiomyopathy, RCM. RCM is characterized by the stiffening, restrictive, of the heart muscle, making it difficult for the heart to fill with blood between beats. Symptoms can include fatigue, shortness of breath, and swelling of the legs and abdomen. RCM can result from conditions such as amyloidosis, sarcoidosis, and other infiltrative diseases, as well as scarring of the heart muscle. 4. Arrhythmogenic right ventricular dysplasia/cardiomyopathy, ARVD/C. ARVD/C is a rare type of cardiomyopathy that primarily affects the right ventricle and is associated with the replacement of heart muscle with fatty or fibrous tissue. It can lead to arrhythmias, abnormal heart rhythms, and an increased risk of sudden cardiac arrest. V. Noncompaction cardiomyopathy, NCC. NCC is characterized by a structural abnormality in the heart muscle, where the myocardium has a spongy or noncompact appearance. Symptoms can vary widely and may include heart failure, arrhythmias, and blood clot formation. Treatment for cardiomyopathy depends on the specific type of cardiomyopathy, its underlying causes, the severity of the condition, and individual patient factors. The main goals of treatment are to manage symptoms, improve heart function, and address any underlying causes or contributing factors. Here are some general treatment approaches for cardiomyopathy. I. Lifestyle modifications. Diet. A heart-healthy diet low in sodium can help manage fluid retention and blood pressure. Reducing or avoiding alcohol and caffeine may also be recommended. Exercise. Regular, moderate exercise can help strengthen the heart muscle and improve overall cardiovascular health. However, exercise recommendations should be tailored to the individual's condition. 2. Medications. Angiotensin-converting enzyme, ACE, inhibitors or angiotensin II receptor blockers, ARBs. These medications can help relax blood vessels, reduce blood pressure, and decrease the workload on the heart. Beta blockers can slow the heart rate, reduce blood pressure, and improve the heart's pumping ability. Diuretics may be prescribed to reduce fluid buildup and swelling, edema, in the body. Antiarrhythmics. If the cardiomyopathy is associated with arrhythmias, irregular heart rhythms, antiarrhythmic medications may be used to manage them. Anticoagulants. In some cases, blood-thinning medications may be prescribed to reduce the risk of blood clots, especially if atrial fibrillation or other arrhythmias are present. 3. Device therapies. Implantable cardioverter defibrillator, ICD. An ICD can monitor heart rhythms and deliver electric shocks to restore normal rhythms in case of life-threatening arrhythmias. Cardiac resynchronization therapy, CRT. CRT involves the implantation of a special pacemaker that can coordinate the contraction of the heart's chambers in people with certain types of cardiomyopathy and heart failure. Ventricular assist devices, VADs. VADs are mechanical devices that can help pump blood when the heart is weak. They may be used as a bridge to transplant or as destination therapy for individuals who are not candidates for heart transplantation. 4. Surgical interventions. Heart transplant. In cases of severe heart failure that do not respond to other treatments, heart transplantation may be considered. Septal myectomy. This surgical procedure may be performed in hypertrophic cardiomyopathy to remove excess heart muscle that obstructs blood flow. Valve repair or replacement. If cardiomyopathy is associated with significant heart valve problems, surgical repair or replacement of the affected valves may be necessary. Management of underlying causes. If cardiomyopathy is secondary to an underlying condition, such as high blood pressure, diabetes, or thyroid disorders, treating the underlying cause is essential. Supportive care. Cardiac rehabilitation programs can help individuals with cardiomyopathy improve their physical and emotional well-being through exercise and education. Lifestyle changes, such as smoking cessation and weight management, may be advised. 2. Pericarditis. Pericarditis is the inflammation of the pericardium, which is the double-layered membrane surrounding the heart. This condition can lead to chest pain, discomfort, and other symptoms. Pericarditis can range from mild and self-limiting to severe and potentially life-threatening, depending on its cause and extent. Here are key points to understand about pericarditis. Causes of pericarditis. 1. Viral infections. Viral infections, such as Coxsackie virus, are the most common cause of acute pericarditis. Other viral infections, including the flu, can also lead to pericarditis. 2. Bacterial infections. Bacterial pericarditis is less common but can be more severe. It can result from infections such as tuberculosis or endocarditis. 3. Autoimmune conditions. Conditions like lupus or rheumatoid arthritis can lead to autoimmune pericarditis. 4. Heart attack. Pericarditis can develop as a complication of a heart attack. 5. Cancer. In rare cases, pericarditis may be associated with cancer that has spread to the pericardium. 6. Medications. Certain medications, such as hydralazine or isoniazid, can cause drug-induced pericarditis. 7. Trauma. Blunt or penetrating chest trauma can lead to traumatic pericarditis. 8. Radiation therapy. Chest radiation therapy, often used in cancer treatment, can cause radiation-induced pericarditis. 9. Idiopathic. In some cases, the cause of pericarditis remains unknown. Idiopathic. Symptoms of pericarditis. Chest pain. The hallmark symptom of pericarditis is chest pain, which is typically sharp, stabbing, or pleuritic, worsened with deep breaths or movement. The pain may radiate to the neck, shoulder, or back and is usually relieved by sitting up and leaning forward. Fever. A low-grade fever is common with pericarditis. Difficulty breathing. Shortness of breath may occur, especially if there is a significant amount of fluid, pericardial effusion, in the pericardial sac. Cough. A dry cough can be associated with pericarditis. Fatigue. Generalized weakness and fatigue are often present. Pericardial friction rub. A characteristic rubbing or scratching sound, known as a pericardial friction rub, may be heard during a physical examination. Treatment of pericarditis. The treatment of pericarditis depends on the underlying cause and severity of symptoms. For viral or idiopathic pericarditis, treatment may involve rest, pain relief with nonsteroidal anti-inflammatory drugs, NSAIDs, and sometimes colchicine to reduce inflammation. Antibiotics are used for bacterial pericarditis. Severe cases with significant pericardial effusion or cardiac tamponade may require drainage of the fluid through a procedure called pericardiocentesis. In cases of recurrent pericarditis or chronic pericarditis, additional medications or treatments may be necessary. 3. Myocarditis. Myocarditis is an inflammatory condition that affects the myocardium, which is the muscular layer of the heart responsible for its pumping action. Myocarditis can result from various causes, including viral infections, autoimmune diseases, or exposure to toxins, and it can lead to a range of symptoms and complications. Here are key points to understand about myocarditis. Causes of myocarditis. 1. Viral infections. The most common cause of myocarditis is viral infections, such as enteroviruses, for example, Coxsackie virus, adenoviruses, and others. Viruses can directly infect the heart muscle, triggering an immune response and inflammation. 2. Bacterial infections. Certain bacterial infections, such as those causing diphtheria and Lyme disease, can lead to myocarditis. 3. Autoimmune diseases, conditions like lupus, rheumatoid arthritis, and sarcoidosis can result in autoimmune myocarditis, where the immune system mistakenly targets and damages the heart muscle. 4. Toxic exposures, exposure to toxins, drugs, or chemicals, including alcohol and certain medications, can cause toxic myocarditis. 5. Other causes, myocarditis can also occur as a complication of other diseases, such as HIV/AIDS, or as a result of radiation therapy. Symptoms of myocarditis. The symptoms of myocarditis can vary widely and may include chest pain or discomfort, shortness of breath, fatigue, rapid or irregular heartbeat, arrhythmias, swelling in the legs and ankles, edema, and flu-like symptoms such as fever and body aches. In severe cases, myocarditis can lead to heart failure, cardiogenic shock, or sudden cardiac death. Treatment of myocarditis. The treatment of myocarditis depends on the underlying cause and severity of the condition. For viral myocarditis, treatment may involve rest, symptom management, and antiviral medications if a specific viral cause is identified. In cases of autoimmune myocarditis, immunosuppressive medications may be prescribed to reduce inflammation and suppress the immune response. Supportive care, including medications to manage heart failure and arrhythmias, may be necessary if the condition has led to heart dysfunction. In some severe cases, mechanical circulatory support, ventricular assist devices, or heart transplantation may be considered. 4. Endocarditis. Endocarditis is a serious infection of the endocardium, which is the inner lining of the heart chambers and valves. This condition is typically caused by bacteria, although it can also result from fungi or other pathogens. Endocarditis can damage heart valves, affect blood flow, and lead to various complications if not promptly treated. Here are key points to understand about endocarditis. Causes of endocarditis. 1. Bacterial endocarditis. Most cases of endocarditis are caused by bacteria. The bacteria can enter the bloodstream through activities such as dental procedures, surgeries, or from infections elsewhere in the body. Once in the bloodstream, the bacteria can adhere to damaged heart valves or areas of the endocardium and cause an infection. 2. Fungal endocarditis. Fungal endocarditis is less common and typically occurs in individuals with weakened immune systems or pre-existing heart valve disease. 3. Other pathogens. Although rare, endocarditis can also be caused by other microorganisms, such as certain types of fungi or, exceptionally, by non-infectious causes like blood clots or foreign objects. Risk factors for endocarditis. 1. Heart valve disease. Individuals with damaged or artificial heart valves are at increased risk for endocarditis. 2. Congenital heart defects. Some congenital heart defects increase the risk of developing endocarditis. 3. Previous endocarditis. A history of endocarditis increases the risk of recurrence. 4. Intravenous. 4. Drug use. Sharing contaminated needles and equipment can introduce bacteria into the bloodstream, increasing the risk of infection. 5. Dental procedures. Dental work or oral surgery can introduce bacteria into the bloodstream. Although the risk is low, individuals with certain heart conditions may be given antibiotics before these procedures to prevent endocarditis. 6. Surgery or medical procedures. Certain surgical or medical procedures that involve the urinary or gastrointestinal tracts can also increase the risk of endocarditis. Symptoms of endocarditis. Symptoms of endocarditis can vary widely and may include fever, fatigue, weakness, night sweats, joint and muscle pain, and unexplained weight loss. Cardiac symptoms can include new or changing heart murmurs, chest pain, shortness of breath, and palpitations. The clinical presentation can be acute, rapid onset, or subacute, gradual onset, depending on the type of bacteria and other factors. Treatment. Treatment typically involves a course of intravenous, 4, antibiotics for several weeks to eradicate the infection. In some cases, surgery may be necessary to repair or replace damaged heart valves or remove infected tissue. Hospitalization is often required for the administration of 4 antibiotics and close monitoring. 5. Pericardial effusion. Pericardial effusion is a medical condition characterized by the accumulation of an abnormal amount of fluid in the pericardial sac, which is the double-layered membrane that surrounds the heart. The pericardial sac normally contains a small amount of fluid to allow for smooth movement of the heart within the chest. However, when excess fluid accumulates, it can compress the heart and interfere with its ability to pump blood effectively. Here are key points to understand about pericardial effusion. Causes of pericardial effusion. 1. Infections, viral, bacterial, or fungal infections, such as pericarditis, can lead to pericardial effusion. 2. Inflammatory conditions, autoimmune diseases like lupus or rheumatoid arthritis can cause inflammation in the pericardium and subsequent effusion. 3. Cancer, pericardial effusion can be associated with cancer that has spread to the pericardium or nearby structures. 4. Cardiac procedures, certain cardiac procedures or surgeries may result in pericardial effusion as a complication. 5. Trauma, chest trauma, such as a car accident or a penetrating injury, can lead to blood or other fluids accumulating in the pericardial sac. 6. Radiation therapy, chest radiation therapy, often used in cancer treatment, can cause inflammation of the pericardium and effusion. 7. Medications, some medications, such as hydralazine or isoniazid, can lead to drug-induced pericardial effusion. Symptoms of pericardial effusion. The symptoms of pericardial effusion can range from mild to severe and may include chest pain or discomfort, which is often sharp and worsens with deep breaths or lying down, pleuritic pain. Other symptoms can include shortness of breath, cough, fatigue, palpitations, and a sensation of fullness or pressure in the chest. In severe cases, when the effusion compresses the heart and impairs its function, symptoms of heart failure may occur, such as swelling of the legs and ankles, edema, rapid heartbeat, and difficulty breathing. Treatment of pericardial effusion. Treatment of pericardial effusion depends on its underlying cause and severity. Mild effusions that do not cause significant symptoms or impair heart function may be monitored closely without immediate intervention. If the effusion is causing symptoms or is due to an underlying infection or inflammatory condition, treatment may involve medications, such as anti-inflammatory drugs or antibiotics. Large or symptomatic effusions may require pericardiocentesis or a surgical procedure to drain the excess fluid. In some cases, treatment may also involve addressing the underlying condition or disease that led to the effusion.